Good afternoon, YouTube world. So if you're finding this video, you probably have been looking up videos for back surgery or microdiscectomy or back pain or that kind of thing, and stumbled across me among the many that are out there. This is the sixth in a short series of videos I've been doing, just kind of detailing the process for me from initially feeling that twinge of back pain to the incredible pain that followed to the decision to do surgery and all that kind of stuff. And I did do the surgery, and this I'm a little bit late. I meant to come in here exactly on the 6-month date, but I didn't. It's 2 weeks later. My surgery was in December of 2016, so I'm at the 6-month and 2-week time period. And so what I wanted to just go into real quickly and hopefully very briefly is just kind of what has been going on since the 3-month mark. So the 3-month mark was the magic turning point where you've like 75% of re-herniations occur in that first 90 days. So you pass that 90 days and you're all good. So that's a good happy turning point. And at that point my physical therapy was going well. The exercises I could do had started to increase a little bit. And what has happened since then is I just reached the 6-month point, as I mentioned, and have done several things. One, I was able to start swimming again right about, once the weather warmed up enough to jump in the pool since April. So at about the 4-month point, started swimming, and that was nice. And then I started being able to do a little more intensive or a variety of resistance training. My push-ups were done on the knees, so I had to modify a little bit, and but I could do a little more dumbbell work and some things like that. And around the 5-month mark, I was able to start kind of trying to do sort of a modified version of P90X again, and that has been fabulous. And when I got to the 6-month point, what was really exciting was they said that's when I could experiment with starting to jog again, because I've been a long time kind of jogger, runner, lots of 5Ks and 10Ks and a couple marathons and all that, and I enjoy that quite a bit, and I thought maybe that was going to be lost to me, but in the last couple of weeks I've been able to very slowly ease into, it's kind of like, I call it shuffle jogging, but I've been able to start kind of jogging and jog walk combo, and just did 5 miles the other day, so that was super exciting. And I really didn't even mean to do this, didn't intend to, but I even got on a racquetball court and started swinging a racket a little bit, and actually played a few games, and kind of came through that okay. I had a couple of moments where I was like, be careful, a little over concerned, but it actually turned out fine, and so that's been awesome. I've been really fortunate. The results of my surgery have been great. I have had virtually zero pain, and certainly the few little pains that I've had is just nothing. It's nothing like what it was. Okay. I've had some tightness around the incision area now and then, little moments of feeling that little shocky sort of sciatic pain that put me on my back for 6 weeks back in November and December, but they've been kind of really short-lived and transient, and I've been pretty pain-free. No pain meds. Rarely have I think I iced it one time, my lower back in the incision area. So very fortunate. Now I was very careful, and I did follow the rules. No bending, lifting, twisting. I did my physical therapy. I increased things very gradually, and I continue to do that. Not doing anything crazy. If I do exercises like in P90X that I used to could do, and it just doesn't feel right, I just don't do it. But all in all, it's gone very well. Very fortunate. So if you're on the fence, I'd encourage you to watch my whole little series of videos detailing the whole decision process and kind of why I chose to do the surgery or whatever. But there are also other people on there, I can't remember their names anymore, but just look them up, microdiscectomy and back surgery and all that kind of stuff, and you'll find my videos, other people's videos, and all that was very helpful to me in my whole process and deciding to go for the surgery. And I'm hoping that in some small way I might help somebody else with their decision process as well. But anyway, it's 5 minutes, so I'm going to get off of here. I don't know what to say other than I wish you the best of luck. I can't make the decision for you. Only you can make the decision as to whether you want to go for something scary like a back surgery. But I can just give you my testimony that it worked out great. I found a great surgeon. I followed the rules. I had good physical therapy, and it's coming around. You know, you're scared that you're just kind of ruined forever, and if you just take your time and make good decisions and don't rush things, you can make a pretty good comeback, I think. But I wish you the best of luck in the whole process. I'll say sort of a blanket prayer for everyone who's struggling with the decision, and I wish you the best. And please feel free to contact me through YouTube or whatever, Gmail, if you have any questions, or just reply to the video, and I'll get back to you. That's it. So best wishes. Happy 4th of July, a day late, and God bless. Bye-bye.